Before I went to go see Dr. Roshek, I actually had seen my family doctor because I had some pains down the growing area. It was severe pain. It hurt to walk. It hurt to do basically just anything really. And it became too severe for me to handle.
Groin hernias either can be one-sided or both-sided. Typically, if a patient has a one-sided groin hernia, I recommend the open hernia repair for that patient. I make an incision in the groin, we fix the hernia, and we'll typically use a piece of mesh to repair the hernia. If the patient has a dual-sided groin hernia, I find that the laparoscopic technique is more beneficial because we can make this small incisions that we use for the laparoscopic technique and fix both hernias at the same time. We found that the laparoscopic technique and the open technique are very similar in regards to durability of the repair and recurrence. However, we've seen that the laparoscopic technique allows patients to go back to work sooner, and a lot of times we'll have less pain in the postoperative period.
When I went to see Dr. Roshek, he did the full exam again, and at that time he discovered a second hole in my intestinal wall.
So in Anthony's case, he was starting to feel growing pain, and he thought it was just on one side, but it turns out that when I saw him in the office, he actually had a hernia on both sides. And this hernia was really making it hard for him to do what he loves, which is mainly he likes to hike. And when he's hiking, he participates in geocaching, where basically you're on a glorified treasure hunt. So it was really holding him back from that. He was noting a lot of pain when he was trying to go hiking and enjoy his life. Once the hernias were diagnosed, we settled on the laparoscopic technique to fix both sides at once.
After the surgery, it was 3 or 4 days. The surgery was on Wednesday. Not being one who likes to be cooped up, a very active kind of guy, I like to be able to get out. From then, it was a little bit more at a time. By Monday, I was back at work.
And since surgery, he's been doing great, and he's out there hiking and geocaching all the time now.
Dr. Roshek, as a doctor, he was extremely welcoming. He's extremely friendly, extremely open, a very good person.